What is dengue fever? Dengue is a viral infection that is spread from mosquitoes to people. It is more common in tropical and subtropical regions than in temperate climates. Dengue fever is also known as breakbone fever due to the severe joint and muscle pain it causes, sometimes feeling like bones are breaking. Symptoms of dengue fever in a patient. Dengue commonly causes flu-like symptoms, such as high fever, often 104 degrees Fahrenheit 40 degrees Celsius or higher. Headache. It is usually intense, especially behind the eyes. Pain. Severe muscle, joint, and bone pain, hence breakbone fever. Rash. A red rash can appear on the body a few days after fever starts. Nausea and vomiting. Fatigue and weakness. Swollen glands. Severe dengue can cause bleeding, extreme fatigue, vomiting blood, or severe stomach pain, thus requiring urgent care. Most people recover in a week, but severe cases can be life-threatening. Which mosquito is the cause of dengue fever? Dengue fever is caused by mosquitoes of the Aedes genus, primarily the Aedes aegypti mosquito. This mosquito has following key identification features. Color and markings. It has a black body with distinctive white markings, including bands on legs, and spots or stripes on the body. Thorax. Aedes aegypti has a lyre-shaped, like a small harp, pattern of white scales on its back. Aedes albopictus, Asian tiger, has a single white stripe down its back. Size. It is small, about 3 to 7 millimeters long, roughly the size of a pencil eraser. Behavior. It bites during the day, unlike many mosquitoes, and often bites around ankles and legs. Posture. It may hold its body at an angle when resting. What are the 3 stages of dengue fever? Dengue fever progresses through 3 distinct clinical phases: the febrile phase, the critical phase, and the recovery phase. Recognizing these phases is vital for effective management, as the most dangerous period often begins when the fever subsides. Let's discuss them one by one. The first phase of dengue is febrile phase. This is the initial phase, usually lasting 2 to 7 days. It is characterized by the presence of the virus in the bloodstream. This phenomena is known as viremia. Symptoms. Patients typically experience a sudden onset of high-grade fever, up to 40 degrees Celsius or 104 degrees Fahrenheit. Other common symptoms include severe headache, retroorbital pain, the pain behind the eyes, intense muscle and joint pain, leading to the nickname breakbone fever, facial flushing, nausea, vomiting, and a rash. Clinical focus. Management during this phase is mainly supportive, focusing on fever reduction, using only acetaminophen or paracetamol, and avoiding NSAIDs like aspirin or ibuprofen, which can increase bleeding risk. Ensuring adequate oral fluid intake. The next phase is critical phase. The critical phase typically begins around day 3 to 7 of the illness, coinciding with defervescence, when the fever drops to normal or below normal. This phase usually lasts 24 to 48 hours. And is the most dangerous period. Symptoms. Though the patient may feel better as the fever breaks, this is when increased capillary permeability can lead to plasma leakage from the blood vessels into surrounding tissues and body cavities, like the chest and abdomen. Symptoms. This can result in significant drop in platelet count, known as thrombocytopenia, increased hematocrit, due to fluid loss from the bloodstream, accumulation of fluid in the chest, known as pleural effusion, and in abdomen, known as ascites, Potential for severe bleeding, especially if prolonged shock occurs. If leakage is severe and untreated, it can lead to shock, dengue shock syndrome, organ failure, and death. Clinical focus. Close monitoring for warning signs. For example, severe abdominal pain, persistent vomiting, mucosal bleeding, lethargy or restlessness, and rapid breathing is crucial. Patients with warning signs require urgent medical attention and often intravenous fluid therapy. The last phase of dengue is recovery phase, also known as convalescent phase. If the patient survives the critical phase, they enter the recovery phase, which typically lasts 48 to 72 hours. Symptoms. The patient's condition gradually improves, appetite returns, gastrointestinal symptoms abate, and vital signs stabilize. Extravasated fluids are reabsorbed into the bloodstream, leading to increased urine output, diuresis. A characteristic isles of white in a sea of red rash may appear and be itchy. Clinical focus. The main risk in this phase is fluid overload, from overly aggressive fluid replacement during the critical phase. Monitoring fluid balance and ensuring gradual recovery is key. Fatigue may persist for some time after recovery.